I was all the time under the impression that challenges that we were faced with as nurses were unique in South Africa.
Over 1 million teachers, nurses, and other government workers went on strike across South Africa this week.
I was very much amazed when I could now visit other countries. I could talk to people from other countries, my colleagues. It is then that I realized that actually the challenges are the same.
Desde 2011, na próxima terça-feira, a mobilização é em frente ao Palácio do Buriti.
Public services like health and continue to refuse to accept our ratio claim for safe care.
We know that there's an agenda the healthcare corporations have and that Wall Street has and the financial sectors have, and that is to take as much profit from public services as possible and to have that wealth transferred to themselves. That is an international agenda, and we have to have an international organization to offset that. National Nurses United was the founding mother of the GNU. People came together, their hearts were in the same place, their minds were in the same place, and the militancy and the inspiration that the nurses in the U.S. received from the nurses and other healthcare workers throughout the world was enormous.
This negotiation must end with a real improvement in the working conditions of the care professionals.
These folks, they take risk. They take a stand. They are fighting to save themselves and to save the lives of their countries. And the kind of stands that they take, they're life-threatening. And in fact, we've lost leaders of the GNU already through these fights.
En estos primeros 6 meses del año, 4 dirigentes sindicales han sido asesinados. 2 directamente de nuestro comité ejecutivo de nuestro sindicato.
Registered nurses and nurses throughout the world are fighting for their lives, and they're fighting for the lives of everyone. When a person is in need of care, a registered nurse, a nurse, doesn't abandon that patient. They stand for that patient, and they stand under the most adverse conditions.
In her hands, the whole wide world. In her hands, she's got the whole.
The nurses of the U.S. are learning from the nurses throughout the world about the tremendous value of their national health care systems.
It doesn't matter whether you're the richest of the rich or homeless and down on your luck. It's universal health care for all.
We call it the National Health Insurance. It is a policy of our political party, which is the African National Congress.
Pero vivimos tratando de que no la privaticen.
What's happening is that the corporations are going into the other countries and trying to destroy their healthcare systems. There's a shift from the public to the corporations nationally. Healthcare is the new desirable commodity.
Decimos allá que la democracia se para en la puerta del hospital privado. Como sindicato de enfermería estamos muy preocupados por el giro que está tomando esta situación. Cualquier enfermera o enfermero que dentro de una clínica privada mencione la palabra sindicato, automáticamente la echan del trabajo.
Almost all public hospitals under our Department of Health are scheduled to be privatized. It is now that we have a very big fight. We have continuous mass actions. We have actually delayed their process.
Pero nuestro sindicato ahí se ha impuesto y ha organizado a todo el personal de enfermería de la mayoría de esos hospitales.
It's a medical industrial complex. That's what we're all confronting, both in the United States and internationally. That's the same agenda that's in all sectors of the economy, and that is to transfer wealth from the people to a few top echelon corporations. And it is an attack on the staffing standards of registered nurses and other healthcare workers in every country throughout the world.
Hospitals are trying to substitute nurses with basically anything that they can find. But that's something that our members gel around in a way that you couldn't have anticipated, and they will do anything to keep and improve those ratios, and I do mean virtually anything, and have to sometimes.
Australia was the first to kick this day off, and we thought we'd do it with a little bit of style.
אנחנו צריכים להבין שבשביל להגיע לתקינה עשינו שביתת רעב. זו הייתה הפעם הראשונה שאחיות שבתו מעל 15 יום שביתת רעב, שסוף סוף שיהיה הסכם תקינה, אז יש לנו הסכם תקינה.
This is a question of safety. In the acute care sector, it's patients in hallways. But imagine the dignity of these patients in hallways waiting for care.
Keeping them is not enough. We have to improve them. We have to get them into places where we didn't have them before.
They want to remove registered nurses because registered nurses fight back.
Porque hoje existe movimento no país de fragilizar os enfermeiros, rebaixar. E essa tem sido uma luta das enfermeiras brasileiras. Mostrar para a sociedade que nós somos a base da saúde pública do nosso país.
이유는 돈을 벌어라, 돈벌이 병원에 강요하다 보니까 인원을 감축한다던가 비정규직이 더 확대가 된다던가 공공부문들을 줄이겠다, 사이즈를 이렇게 하면서 그 대표적인
We have had the protests, we have taken to the streets. We are at this stage saying we've had enough.
Working on the wards will work for less than the minimum wage
La estrategia también está en la movilización constante.
The same sources that are trying to destroy the profession of registered nurses are also destroying our planet. The dramatic health effects of the environmental crisis are felt profoundly by the registered nurse as they see what happens with patients.
Don't pipeline my patients. Don't pipeline my patients. Don't you dare pipeline my patients. Join nurses in opposing the Keystone XL pipeline for the health of everyone.
There's so many health consequences of a planet that is essentially being devastated.
Y apoyamos todo lo que son las campañas con los ambientalistas, no solo sindicatos, sino de todas las personas interesadas en la protección del medio ambiente.
We saw at a very early stage in the formation of the GNU just the tremendous power of the GNU. When there was a typhoon in the Philippines, we were able to deploy through our registered nurse response network registered nurses from the U.S. to the Philippines, and we were networked throughout the country.
We are united to fight for affordable, accessible, and for the people's health care.
It gives me hope because I realize that there is no nurse, there is no country in terms of the nursing challenges that is isolated. And precisely because we have the same challenges, for me, it gives me hope that if we can unify, if we can fight together, then we can achieve a lot.
The GNU is an enormously powerful formation of nurses. This is the first time in history that registered nurses and nurses have come together to take a stand against the devastation that's happening in their countries. And it's building, and nurses are joining, and it's very, very exciting. These nurses that are together will actually resolve the problems of the world. I am completely convinced of that. Registered nurses left to their own devices are unstoppable.
Además, el cumplir con un mandato, amar a su prójimo como a uno mismo, ser lo mejor, ser capaz de dar la vida por amor.